Peripheral neuropathy is one of the most common and most frustrating complications of type 2 diabetes. For many patients, it starts quietly, a little tingling, a little burning, a little numbness in the feet. Then it can progress into constant pain, sleep disruption, balance problems, and difficulty walking. And for years, people were often told the same thing: manage it, but don't expect it to improve. But that is not the whole story. The science is showing us something important. Diabetic neuropathy is not just a nerve problem, it is a metabolic problem. And that means the path to improvement is not only pain control, it is restoring the biology that damaged the nerves in the first place. When we talk about reversing neuropathy, we have to be precise. Not every case is fully reversible. Not every nerve recovers completely. But many patients can improve. Pain can lessen. Function can improve. And in some cases, nerve health can recover meaningfully when the root cause is addressed early and aggressively. That is the real goal. Not just suppressing symptoms, restoring the system. To understand why neuropathy happens, we need to understand what peripheral nerves depend on. Healthy nerves need stable energy production, good blood flow, low inflammation, low oxidative stress, and adequate nutrient support. When type 2 diabetes disrupts those systems, nerves become vulnerable. The first major issue is chronic hyperglycemia. When blood sugar stays elevated for long periods of time, it injures nerves in several ways. It increases oxidative stress. It impairs mitochondrial function. It promotes inflammation. It disrupts microcirculation. And it contributes to the formation of Advanced Glycation End Products, or AGEs. These AGEs are harmful compounds formed when excess glucose binds to proteins and lipids in the body. Over time, they damage tissue structure and worsen inflammation. So diabetic neuropathy is not caused by one single mechanism. It is caused by several overlapping mechanisms that slowly damage the nerve and the small vessels that feed it. That is why neuropathy often becomes progressive. The nerve is being injured from multiple angles, not just by sugar, but by the downstream biology that high sugar creates. And that is also why simply treating pain often falls short. If you only numb the symptom but do not change the metabolic environment, the injury continues. Another major factor is insulin resistance. Type 2 diabetes is not just a disease of glucose, it is a disease of metabolism. When the body becomes insulin resistant, energy handling becomes inefficient, fat metabolism becomes abnormal, inflammation rises, mitochondrial function declines, and the nervous system pays the price. That matters because nerves are highly energy dependent. They need efficient fuel handling to maintain signal transmission and repair. When metabolism breaks down, nerve function suffers. There is also a vascular component. Peripheral nerves rely on tiny blood vessels for oxygen and nutrients. Diabetes damages those vessels. That means less perfusion, less oxygen delivery, and less ability for the nerve to repair itself. So neuropathy is really a combination of nerve injury, vascular injury, and metabolic injury. That is why a root cause approach is so important. Now let's talk about what actually helps. The foundation is better glucose control. Lowering glucose reduces ongoing nerve injury. It reduces glycation. It reduces oxidative stress. It reduces the toxic metabolic burden on the nerves. That does not mean chasing perfect numbers. It means improving the overall pattern. Better fasting glucose. Better post-meal glucose. Better long-term control. That is one of the most important steps in protecting nerve health. But glucose control is only one part of the picture. Insulin resistance also needs to be addressed. Because if insulin resistance stays high, the metabolic environment remains unhealthy. That is where lifestyle change becomes powerful. Exercise is one of the most effective tools we have. It improves insulin sensitivity, it improves circulation, it supports mitochondrial function, and it helps lower inflammation. For patients with neuropathy, exercise must be individualized. Some people can walk daily, some do better with resistance training. Some need low-impact exercise. The key is consistency. The best exercise is the one a patient can actually maintain. Even modest movement done regularly can make a meaningful difference. Nutrition is just as important. A lower glycemic whole food eating pattern can reduce glucose swings. That usually means fewer refined carbohydrates, less added sugar, more protein, more fiber, and more healthy fats. Some people do well with a Mediterranean-style pattern, others do better with a more carbohydrate-restricted plan. The best plan is the one that improves blood sugar and is sustainable. Now let's talk about nutrients, because nerves are very sensitive to nutritional status. Vitamin B12 is especially important. Low B12 can worsen neuropathy symptoms. And this matters even more in patients taking metformin, because long-term metformin use can contribute to B12 deficiency. B12 supports myelin integrity and nerve function. Vitamin B1, or thiamine, is also important. It supports nerve metabolism. Vitamin B6 is more complicated. A deficiency can contribute to nerve problems, but too much B6 can also cause neuropathy. B vitamins should be used thoughtfully. Omega-3 fatty acids may also help. They support cell membrane health and may help reduce inflammation. They are not a cure, but they can be useful as part of a broader anti-inflammatory and metabolic strategy. C15 is an emerging area of interest. It has been discussed for possible roles in membrane stability, but we need to be scientifically honest. It is not yet an established neuropathy treatment. The evidence should always guide the claim. Now let's talk about symptom relief, because patients are not living in a research paper. They are living with pain, burning pain, tingling, nighttime discomfort, sensitivity in the feet. One of the best studied topical options is capsaicin. Capsaicin is the compound that gives chili peppers their heat. When applied to the skin, it interacts with TRPV1 pain receptors. Over time, it can help reduce the nerve's ability to transmit pain signals. Capsaicin does not repair the nerve itself, but it can give patients meaningful relief while the deeper metabolic work is underway. That makes it a valuable part of a broader treatment plan. Another topical some patients ask about is copaiba oil. From a scientific standpoint, the evidence for neuropathy is much less established than for standard medical therapies, so it should be viewed carefully. It should not be presented as a proven neuropathy treatment. The practical message is simple. Topical therapies can help with comfort, supplements can support nerve health, lifestyle changes can improve the metabolic terrain. But the real long-term solution is correcting the biology that caused the damage. That means looking at the whole picture: blood sugar, insulin resistance, inflammation, circulation, nutrition, movement, sleep, and nutrient status. That is how we move from symptom management to root cause treatment. That is how we move from simply masking pain to giving the nerve a chance to heal. And that is why patients often improve when they finally start asking a different question. Not just how do I stop the pain, but why is this happening? And how do I restore the system that is supposed to heal the nerve? That is the evidence-based approach. That is the metabolic approach. And that is the future of neuropathy care. If you are living with diabetic neuropathy, there is reason for hope. Because when the metabolic environment improves, nerves may stabilize, symptoms may decrease, function may improve. The goal is not just to live with neuropathy. The goal is to treat it at the source. That means addressing diabetes itself, supporting nerve biology, improving circulation, reducing inflammation. That is how we help patients move from pain toward recovery.